Madam Chairwoman, thank you. I'm really glad to be here with you today, the first subcommittee hearing of the year. It's also great to have a fellow Montanan joining us today. We'll get into a more formal introduction in a bit, but a warm welcome to Lynette. I am glad you could be here with us today. May is Mental Health Awareness Month, an issue at the top of my mind and many others following a year of isolation for Montanans and Americans across the country. In fact, last year, due to COVID restrictions, Montanans and Americans were forced to stay home. We saw family-owned and small businesses shutter, workers struggling, family members isolated from loved ones, schools closed, directly impacting our nation's youngest and brightest. Through no fault of their own, hardworking Montanans and Americans across the country lost their jobs, leaving them wondering how they were going to keep a roof over their families' heads and food on the table. Instead of socializing and learning with their friends in classrooms, students were stuck behind computer screens, symptoms of anxiety and depression on the rise. In fact, one survey states that more than half of the adults reported that worry or stress related to the pandemic was having a negative effect on their mental health. And as we all know, mental health issues were a problem before the pandemic. In fact, it's estimated that nearly 1 in 5 American adults had some form of mental illness, but fewer than half of those adults received treatment in 2019. Since the pandemic, lockdowns, economic hardships, social isolation have only helped intensify what we already know, and that is we need mental health services in our communities, and we need to make this a priority. The pandemic has also helped expose and magnify the flaws in our mental health system. Sadly, in 2020, suicide was the 10th leading cause of death, and drug overdose deaths hit a record high. In Montana, we are unfortunately not immune to these devastating statistics. We're 4th in the nation for suicides. We're 1st in the nation per capita for children placed in foster care, most often due to a parent's drug or alcohol use. And we're witnessing a disturbing increase in meth-related violent crime. It's clear that more needs to be done to support individuals and families struggling with addiction or mental illness. We are fortunate in Montana to be home to treatment facilities like Rimrock, which I've had the opportunity and the privilege of visiting several times over the years. In fact, I even had the opportunity to bring Vice President Pence and his wife Karen to show them firsthand the great work the organization does for Montanans struggling with addiction and mental health issues. In fact, one visit I'll never forget, had the chance to meet with a few moms who were receiving substance use treatment. I'd just become a grandfather. I was overwhelmed with emotion to see these little ones there with these moms struggling with these addiction issues. But there I saw devotion, I saw struggle, I saw commitment, and so much love that the Montana moms had for their children. Because at Rimrock, thanks to a bill that I led in the Senate and was signed into law by President Trump, moms who are working to get back on their feet are able to stay with their children. Let me tell you, that means the world to these moms. It gives them a reason, a very important reason, to get better. Treatment centers like Rimrock make a world of difference in our communities, and they're more important now than ever before as we come out of this pandemic. And after years of lockdowns and closures, we're finally starting to see light at the end of the tunnel. And thanks to the leadership of our new governor, Greg Gianforte, life in Montana is on its way back to getting to normal. We've vaccinated over 350,000 Montanans and have led the nation in vaccine administration. We are now open for business in Montana. We're open for school. We're incentivizing getting back to work versus staying home, something I believe is also important for mental health, because I believe there's dignity in work. But the reality is that there will be likely long-lasting impacts of the pandemic, particularly on mental health. We must aim to meet the challenges of today and prepare for the increased need that this pandemic has created. So I'm very committed to working with my colleague, Senator Stabenow, towards that goal. And again, I appreciate our witnesses being here today, offering their advice, their expertise on such a very important topic. Thank you, Madam Chairwoman.